Cloud.
Or just gotta get myself up here. Okay, cool. Um, cool. So I'm gonna introduce you, and then the floor be yours.
Thank you.
Hey, right here from Hiles. Welcome, everyone. Thank you, Ashley, for being here. We are so of your expertise. Ashley started working at the Tick-Borne Clinic in 2020, which is located in Aspirus in Woodruff, Wisconsin, which is considered one of your things to run into the woods around here are ticks. So Ashley is she's just wonderful and really has dedicated her expertise in this field, supporting people outside, even in this nation, in a realm of helping to fight and focus on chronic tick-borne diseases. Trained under Dr. Samuel Shore, a physician who has had over 30 years of experience working with Lyme disease. The lecture today is going to really be focusing on what you need to know, how to identify, what are some of the symptoms of tick-borne diseases, how can we protect ourselves. So we will also touch on the concept of chronic Lyme disease and its complexity and how you can get a diagnosis. So thank you so much. I'm going to turn on the speaker. So there might be some reverb in the room if you guys just want to see. We also have poor connection here, Kyle. I apologize if
it keeps freezing, but it comes
okay.
back.
Mute us, and I'm also going to stop the video, which might help the stream.
Okay. I'm going to see if I can get this. Let's see. I can do this here. Oh, now I lost the video. Can you guys see the slideshow?
Yes, I can.
Yeah, okay, perfect. All right, so as Emily May said, my name is Ashley Johnson. I'm the nurse practitioner at the Aspirus Tick-Borne Illness Center and been here for the past 5.5 years. I've been a nurse practitioner since 2016, moved to the Northwoods in 2020. When I started at the Tick Center, I really didn't have a whole lot of knowledge about tick-borne illness, only what was given to me through my schooling, which wasn't a whole lot. So it was a whole new world to learn, but it's very interesting. So today we're going to go over tick identification. So you guys are able to identify the ticks that you come in contact with, know which ones carry which diseases. We're going to go over tick bite prevention, acute Lyme disease, and other acute tick-borne illnesses. We're going to go over a little bit of the controversy or the differences between the two guidelines that are used to treat these illnesses. And then also we're going to touch on chronic Lyme as well. The whole world of tick-borne illness is very complex, so that we could talk for hours about it, but hoping to just give you guys a base so that you have some knowledge to get you guys through if you do experience a tick bite. All right, so the first tick that we're going to go over is the deer tick. And an interesting fact is when you get bitten by a deer tick, it's always a female. The males do not feed, they die after they mate. But the deer tick is a smaller tick, so it has kind of a sesame seed shape. It has a softer body. It also has a burnt orange color to it. It can be very tiny, especially in the spring. The nymphs or the baby ticks can be the size of a grain of pepper. So they are very, very small, and they are polymicrobial. So what that means is that they can carry multiple infections, and you can contract more than one infection from just one tick bite. Even those tiny, tiny ticks can carry multiple infections. The picture up above is the days and the engorgement level of those ticks. So this is an important picture to also look at to, try to decipher between if it's a deer tick or a wood tick. You can kind of see that the deer tick has more of an oblong shape. It kind of looks like a BB by day 7. Hopefully you find it before day 7, but they can blow up pretty big. And once they're that big, they can be hard to determine what kind of tick it is. But these are the ticks that carry Lyme. These are the ones that you do want to, be very proactive about. So that is the deer tick. The next one is the wood tick or the dog tick. So this is a much larger tick. It has a rounder body. It has a harder shell. It's a dark brown color with a distinct light tan design on its back. These are also polymicrobial. They're known for carrying Rocky Mountain spotted fever, which we don't have a lot of in Wisconsin, but we do see it, as well as tularemia. There have been a few wood ticks that have tested positive for Lyme. I know that Marshall Clinic is collecting ticks, and they have had a few that have come back positive. So that's kind of an interesting thing to look at. So I guess don't ever rule it out, but that's not the norm. Again, you can kind of see at the top how the tick feeds and how it looks. You can see by day 8, it is a huge tick. And yes, we have seen ticks this big on humans, but they kind of look like a raisin when they start to feed and fill. So that is the wood tick. Generally, we don't preventatively treat these types of tick bites. The most worrisome thing with these tick bites is that the skin can become infected more easily. So you just have to monitor the tick bite site a bit closer. All right, and this is the new tick that has come to Wisconsin. This is the Lone Star tick. We don't have a lot of them up here. They're pretty rare still. They are usually in the southern states, but with our warmer winters, ticks are migrating, and these ones have started to migrate north. These ones have a distinct white dot on the back of them. They've been in the news lately because they can transmit a sugar molecule causing alpha-gal syndrome, which we'll talk about later. But they can also cause ehrlichiosis and stari. Stari is actually an infection that can create a rash like Lyme, like the target rash. So it is a tick to be aware of. You don't want to get this tick bite, but they are here, just not in high concentrations. All right, so tick bite prevention. So these are tips to keep ticks off of you. Obviously, you can use DEET. You do want to try to avoid spraying DEET directly on your skin if you can. You don't want to douse yourself if you have short sleeves and shorts on. You really want to try to wear, pants with high socks or high boots, and then spray the DEET on your clothing. This will kill and repel ticks. The other one is permethrin, which is a great treatment that you can do on your shoes and your clothes. So you treat your clothes outside on the grass, and then you let them dry. Once they're dry, then they are good for 3 washes, and it will kill and repel ticks. Permethrin is actually what the DNR uses to treat their uniforms, so it is very effective. Specifically, like if you have specific hunting clothes or clothes that you use while you're in the woods, that would be a great option. There are a lot of great essential oil sprays as well that also repel ticks. I have a list of some of the essential oils that work. You just have to apply them more often, but they certainly can be very effective as well. The other thing you want to do at home is try to decrease the tick population on your property. So you can spray the perimeter of the yard along the edge of the woods. You want to move any entertainment like play sets or fire pits away from the edge of the yard, because that's where those ticks are going to be. You want to keep your grass mowed. And then there are tick tubes. So tick tubes you can purchase, and they actually are like a toilet paper roll that is stuffed with cotton that is soaked in permethrin. So the concept is the mice bring the cotton ball back to their nest, and then that kills the ticks, which then can also decrease Lyme, because most ticks contract Lyme from the white-footed mouse or other small mammals. So the tick tubes you put along the edge of the yard in order to decrease the tick population. Okay, we kind of talked about how you want to dress if you're going to go out in the woods. You also want to wear light colored clothing so you can see the ticks more easily. When you're done, you want to place your clothing in the dryer for 20 minutes on high heat. So water does not kill ticks, cold does not kill ticks, but heat will. So the point is to kill any ticks that are crawling on your clothes so that you don't bring them into your home. You want to make sure that you treat your dogs and your pets, especially if the dogs sleep in the bed with you. That's a huge risk for contracting a tick bite. And then you also want to do your tick checks. So you want to check all the places that are dark, warm, and moist. So behind the ears, your neckline, your hairline, your armpits, your belly button, under the bra line is a common place for ticks to go. You know, the groin, behind the knees, even between the toes. I've seen ticks between the toes. So you really want to do a good tick check. And in the spring, if you notice a new freckle, make sure it doesn't have legs because they are very tiny. Okay. So what do you do if you get a tick bite? If it's a wood tick, if you can identify it as a wood tick or a dog tick, you want to remove the tick as soon as possible. You want to monitor for signs and symptoms of tick-borne illness, which we will go over. You want to monitor the bite site for signs of infection. So that would be increased redness, swelling, drainage, or pain at that tick bite site. Again, we don't really have any preventative treatment for a wood tick bite, but we certainly will treat it if it looks like it's becoming infected. Now, the deer tick is a different story. Again, you want to remove the tick as soon as you can. You don't want to wait. The longer that tick is attached, the higher your risk is for contracting the infections that tick is carrying. You do want to contact your healthcare provider. Ideally, you want to start a preventative course of antibiotics to prevent the development of Lyme disease. And then you want to monitor for any symptoms over the next few weeks. Now, when you go to remove a tick, what this picture is showing is that you don't want to squeeze the tick's body because that is going to squeeze all of those infections right into your bloodstream. So you really want to take the tweezers at the head of the tick and pull straight out. You don't want to put Vaseline on it. You don't want to burn it. You don't want to put peanut butter on it. Those are all things that are going to irritate the tick, and the tick is going to regurgitate, and all those infections are going to go into your bloodstream. So you really want to try to remove the tick as quickly as possible and without irritating the tick. If there's questions, if you just want to speak up, I can't see the chat because when I'm sharing my slideshow, it's covering the whole screen. So if there's questions, just stop me. I'm happy to answer them. Okay, so preventative treatment after a tick bite. There are two different schools of thought. There is the CDC criteria, and then there is ILADS. So ILADS is a group of providers that came together to focus on the treatment of tick bites, Lyme disease, and other tick-borne illnesses. So those are the guidelines that we follow here at the Tick Center. But if you do have a deer tick, the CDC criteria to qualify for preventative treatment is the tick must be identified as a deer tick. It has to be attached for greater than 36 hours. It has to be removed within 72 hours. And if you meet that criteria, you get 1 dose of doxycycline. So a double dose, but only 1 day of doxycycline. Versus the ILAS guidelines, we don't really have a criteria for time of attachment. There have been plenty of studies that show, these infections can be transmitted in less than 8 hours. So we will most likely treat most deer tick bites preventatively. It does have to be a deer tick. And we have a criteria that it has to be removed within 5 days. If you have a tick bite and it was removed 10 days ago, that preventative course of doxycycline is going to lose its effectiveness. So the sooner you can start the treatment, the more effective it is. And we would treat for 20 days with doxycycline for prevention against Lyme disease. So there's just a difference in that criteria. We certainly see a lot of patients that do the 1-day course of doxycycline from a different provider and then come back with symptoms. That's certainly not uncommon. So then we'll go into Lyme disease. So again, Lyme comes from the deer tick. There are many strains of bacteria that can cause Lyme disease or Lyme-like illnesses. But the symptoms of Lyme, most people know the most common one is that bullseye rash. But actually only about 20 to 30% of patients infected with Lyme will develop a bullseye rash. So if you get the bullseye rash, yes, you have Lyme. If you don't get it, but you have other symptoms, you still could have Lyme disease. It also oftentimes presents with fever, migrating joint pain, so pain that moves from joint to joint at different times. Like your knee could hurt one day and then the next day your shoulder hurts and then your elbow. So it's one of the only infections that will cause this migrating joint pain. Neck stiffness, a lot of muscle pain, brain fog, fatigue. There's a variety of symptoms that we see. Not everybody presents the same. And the picture is of the different ways that the bullseye rash can present. So you can have that classic target rash that is shown at the bottom. It can look like a big bruise that just keeps getting bigger. It can look like a big red blotch or oval that also keeps expanding. The one to the left would be a disseminated rash, so meaning they have lesions all over their body. So that would be, a tip that it's more advanced or that it's spread. But those are all ways that Lyme rash can present. And sometimes they're tricky to see that target rash because we certainly have had, patients that bullseye rash is like halfway across their face and through their hairline. So you really do have to look, to make sure that that's what you're seeing. So one of the big controversial aspects of Lyme is the testing. So the CDC testing is a 2-tiered test. The first one is a screen. So it's kind of like they're casting out a net and trying to pull in all these antibodies that might be Lyme specific. If that comes back positive, it used to be reflex to the confirmatory test, which is called the Western blot. However, they have changed that now. It goes onto a secondary screen, which basically just splits it up into the 2 different types of antibodies. The thing about this screen is there actually was a recent study that just came out. Oh, yeah. Oh, yeah. I can't hear if that was a question.
I don't know. I can hear you though.
Oh, okay. Okay. I'll just keep going then.
Yeah.
So the recent study from the Bay Area Lyme Foundation showed that only 23% of patients who showed signs and symptoms of early Lyme tested positive with this standard 2-tier test. And so in turn, it basically says that it missed up to 70% of cases of early stage Lyme disease. And we certainly see this. If we have a patient that comes in with a bullseye rash and we were to run this test on them, odds are it's going to come back negative, even though they have the infection. So, you know, this test is really not helpful, especially when you have a patient who is presenting with acute symptoms, meaning new onset. It's probably going to come back negative. So it's, you know, it's unfortunate because I think a lot of cases get missed because this is what you're supposed to do. You're supposed to run this screen, but it's just not a great test. So we will actually wait about 4 to 6 weeks to do a test, and we will do the Western blot. We also will treat if we suspect tick-borne illness. So we don't wait to start treatment for a test result. So just some information on that. You just can't go off of a negative test if you have symptoms and it's, you know, and a recent tick bite. You want to make sure that you do get that treatment. And then this kind of touches, again, part of what we went over before with the preventative treatment of tick bites, but this is the difference between the CDC, Infectious Disease Society of America guidelines, and then ILADS. So again, Infectious Disease Society of America has a greater reliance on the lab tests and presenting with a bullseye rash. Versus ILADS, you know, we put a greater emphasis on clinical assessment of our patient's symptoms. You know, we don't rely on a test result to determine if we're going to treat or not. We talked about the preventative criteria, acute treatment of Lyme. Unfortunately, the CDC keeps decreasing the amount of days that you are supposed to give for acute Lyme. So it's down to a 10-day course. With ILADS, we would treat for 4 to 6 weeks. And most of the time it is a 6-week course of antibiotics. Doesn't have to be doxycycline, but that is usually what we use if we can. As far as patients who have persistent symptoms, Infectious Disease Society of America would recommend against retreatment for patients. Unless they have specifically Lyme arthritis, carditis, or neurological symptoms. Versus ILADS, if someone has persistent symptoms after a 6-week course of treatment, we would retreat because you don't want Lyme to be left undertreated because that's when it turns into chronic Lyme. So you can see there's kind of this divide within the medical system on which way to treat Lyme. Okay, anaplasmosis. So these are other tick-borne infections that we can see. Anaplasmosis is transmitted by the deer tick. It causes flu-like symptoms with fever. We can also see a lot of GI symptoms, so nausea, vomiting, diarrhea. We see a lot of confusion with anaplasmosis, and you can also get some clues on some of the lab results if this is what they're dealing with. So you see a lot of low white blood cell counts, low platelets, elevated liver enzymes. You can see abnormal electrolyte levels, and these patients are generally very, very sick. They feel like they got hit by a truck. It's treated very effectively with a shorter course of doxycycline. This is not one that we know of as causing long-term issues. Ehrlichiosis, again, is kind of the same concept, flu-like symptoms with fever. You can see the GI symptoms, confusion, the same kind of signs with the labs. Again, treated with doxycycline, short course. It does not usually cause long-term issues, but still good to be aware of it because you can get very, very sick. And these both can be deadly if they're not caught as well for some patients. Okay, so Babesia. This is actually a parasite that is transmitted by the deer tick. The symptoms of Babesia can be air hunger, like you can't get a deep breath of air, drenching night sweats, a lot of muscle pain. It is a malaria-like illness. What it does exactly is it enters the red blood cells, as you can see in this photo, and it basically destroys them. So it can be deadly for patients who don't have a spleen or who are severely immunocompromised. Most people who have a healthy immune system are going to be able to keep this infection at bay, even if they become exposed to it. But where it becomes an issue is, if you develop chronic Lyme, that can suppress your immune system, and then these other co-infections like Babesia can become reactivated and then start to cause problems. So this is one that can persist long term and cause more issues for people. It's very common in our chronic Lyme population. So the alpha-gal syndrome, this one was in the news a while ago. This is from the Lone Star. It's basically a sugar molecule in the Lone Star tick saliva that gets transmitted to the host. And it can cause reactions to any mammalian product, including red meat. So people can become allergic to dairy. They can become allergic to certain medications that are derived from mammals, like pig valves or heparin, which is a blood thinner, actually has a mammalian product in it. So it can be very life-changing for patients if they do contract this. Usually they have experienced the symptoms anywhere from 2 to 6 hours after the exposure. And it can be anywhere from hives to anaphylaxis to abdominal pain and nausea. There is no treatment for it. It's mainly lifestyle modification. So this is one to be aware of. Again, it's not super common here, but we certainly have had a few cases. This one was also in the news. So this is Powassan virus. This comes from the deer tick. Wisconsin has had 3 cases this year so far. We only had 12 in 2024. So hopefully it's not picking up speed. This is a scary one. It can be transmitted within 15 minutes of the tick being attached. It causes an encephalitis or brain swelling and meningitis. It definitely can be deadly. There's no cure because it's viral. It's really only supportive treatments that you would get. The symptoms are fever, weakness, confusion, headaches, loss of coordination, seizures, and you can have vomiting. It is most of the time diagnosed by doing a lumbar puncture and testing the spinal fluid. But we also have antibody testing available through blood tests. The last one is Bartonella or Bartonellosis. So Bartonella is a really interesting infection. It is a parasite that can be transmitted by ticks, black flies, fleas, lice, and cat scratches. There's about 16 strains of it. It is potentially more common than Lyme, and I would argue more complex to treat than Lyme. It causes a variety of symptoms. We can see chronic headaches, a lot of mood disorders. It's been associated with schizophrenia and bipolar, swollen lymph nodes. A lot of patients will describe like skin crawling sensations or feeling like their body is vibrating. Bladder irritability, pain on the soles of the feet is a hallmark of Bartonella. So this often can get diagnosed as plantar fasciitis, but usually the treatments for plantar fasciitis will not resolve the pain, but treatment for Bartonella will. We can see a lot of tingling and numbness. And then we have these specific skin markings. They're called striae or tracts. And they look like stretch marks, but they're located in areas that you would not typically see stretch marks. So you can see in this picture, they're in the middle of the back and they're going horizontal. So these were from Bartonella. And if you actually took a biopsy of these skin lesions, you would find active Bartonella there. So Lyme is certainly a growing epidemic. The CDC recently said there was up to 500,000 cases per year. We believe that it's actually probably almost 10 times more than that because there's a lot of cases that go unreported because of negative testing, but positive responses to treatment. So, you know, it's definitely an illness that we have to have on our radars, and we have to spread knowledge about. So when we talk about chronic Lyme, the CDC does not acknowledge Lyme disease as a chronic infection. They acknowledge it as an acute infection. However, their chronic Lyme is mainly post-treatment Lyme disease syndrome, which is basically the leftover effects of the acute infection. So it doesn't need treatment. With ILADS, they define chronic Lyme disease as a multi-system illness with a wide range of symptoms and signs that are either continuously or intermittently present for a minimum of 6 months. So the debate is whether it is effective or appropriate to still treat chronic patients who are experiencing persistent symptoms with antibiotic courses or to continue treatment. And it is, in my opinion, it definitely is still an active infection because we see people improve using the treatments that we do, including antibiotic courses. So there still is a big, split or a divide, again, with the ILADS guidelines and then the CDC and Infectious Disease Society of America. So for patients, it's really hard to find, providers or clinicians who will accept Lyme disease as a cause for their symptoms, which can be challenging. And on that same token, we have the cost of chronic Lyme disease. So because it's not recognized as an active infection that can persist, these patients get referred for every symptom. So, if they have persistent joint pain, they might get sent to rheumatology. If they have persistent headaches, they might go to neurology. So they just kind of get split in every which way, which costs a lot of money. So, it was an average that it costs the health system between $712 million and $1.3 billion a year for these patients. And, also a lot of these patients have to quit work or cut back down on work because they are so sick, and they just can't recover. So it is a huge problem. So the symptoms of chronic Lyme, I really like the picture on the right because it shows you which of the symptoms are present more often in early Lyme compared to chronic Lyme. But Borrelia or the Lyme bacteria can infiltrate every system, which is why we see such a variety of symptoms in every patient. The diagnosis is often missed because the bacteria has an ability to mimic and present like a lot of other medical issues. They have multiple common complaints, often vague, so fatigue, headaches, chronic pain, mood issues. They often look well, and their blood work is fine, but they don't feel well. So unfortunately, a lot of these patients are viewed as complainers or hypochondriacs, and they are told that they have to see a psychiatrist. And that's, again, very unfortunate, but it's a common case that we hear. So this is John Alcott is doing the SLICE studies, and he's tracking patients, acute Lyme patients, for 6 months post-treatment. And what he found that, of those patients, 39% were still having symptoms or were impaired post-treatment. So that's a pretty shocking number. And it just goes to show you that everybody has a different experience with it. We're all different. Our immune systems are all different. We don't respond to the same things. But unfortunately, we all are kind of told to get put into a box. But that's just not how our bodies work. So how does Lyme persist? So the Lyme bacteria is very smart. It develops many ways to hide from the immune system and hide from treatment. So the first picture down there in box A is the active form of the bacteria. It looks like a spiral-shaped noodle. It's kind of squiggly. It's a corkscrew, and it burrows into your joints and your organs. It can also create a biofilm, which is like a protective slime over the top of itself. And when it's in that biofilm, your immune system can't detect it and antibiotics can't get at it. It can actually remove its cell wall and go into a cell wall deficient form or a persister cell, and it can sit dormant in that form for months or years and then come back out into the active form again and start replicating. It can mildly suppress your immune system. It constantly is changing its outer surface proteins. So those outer surface proteins are what your immune system uses to generate a response against it. So your immune system really has trouble trying to generate that response. And because of that, it also survives. So it has a lot of ways that it can persist. It's just very, very smart. And some of the other ones too, like Babesia can also create biofilm, and nests, and so can Bartonella. So all three of those have ways of persisting and avoiding or evading antibiotics or treatment. Okay, so how do we treat chronic Lyme patients? We take an integrated approach. So we do use prescription medications. We do use antibiotics. We use some off-label meds to treat tick-borne illness. So we use methylene blue. We do use ivermectin for Babesia treatment, disulfiram and hydroxychloroquine. So a few of those you will probably recognize from COVID, ivermectin and hydroxychloroquine. But a lot of our Lyme patients were already on these during COVID, and it was interesting because a lot of them did not get very sick with COVID. We also use a lot of herbals. So there are a lot of great herbals and a lot of studies on these herbals that show their activity against these tick-borne illnesses. So we use a combination. It might be 1 or 2 antibiotics plus a number of herbals. So we're trying to address that active form, the biofilm, and the cyst form, and also addressing co-infections at the same time. We also assess our patients for other deficiencies. We check their thyroids, their vitamin levels, we address their sleep, trying to treat them as a whole person and not just the infection. So it does get pretty complex. On average, we tell people a minimum of 3 to 6 months of treatment. For a lot of people, it's longer. For others, it's shorter. It just really depends on each patient and how they respond. And then just to keep in mind, I like this quote, chronic illness is trying to appear normal, both for yourself and others, with a body that is challenged on every level. So I think that this is very telling of our Lyme patients because they're trying to work, they're trying to run their family, they're trying to be present, but they just feel so sick. And so just want it out there that, you know, there is hope for patients who are suffering with chronic tick-borne illnesses. You have to be an advocate for yourself as a patient as you navigate the health system. And, you know, if you know that something is wrong, don't let someone tell you that it's in your head, because most likely it's not. And then I just have a reference page. So at the Tick Center, we see hundreds of patients each year. And we really try to help as many people as we can. We are fee for service because of how we treat chronic Lyme. And that's all I had.
I can attest to, they're one of the few clinics that I have ever been to where I was treated as a whole person. Everything I was struggling with for 20 years and got diagnosed with investment of getting the relief. And I send everyone I know to the tick clinic.
Yes. And I mean, oftentimes that's how we get patients is, you know, we have whole families that we treat. I think we have one family that we treat eight family members. And, you know, it's just an amazing feeling to help people get their lives back because, you know, they usually have been suffering for a long time, and we are usually one of the last resorts that they're checking into. And the hope with the Tick Center being integrated into a major health system is that we will be able to share that knowledge and hopefully help other healthcare providers see the light and then be able to help more patients and recognize it. So I think we are unique in that way because there aren't a lot of tick centers or providers who treat tick-borne illness that are associated with a big health system.
Yeah, there was a question in the chat just asking the name of the clinic.
Oh, yeah. So it is
And we answered that as Woodruff Tick Clinic.
It's the Aspirus Tick-Borne Illness Center. I can write it. We also offer specialized testing. So we use a lab out in California called IGeneX. They're kind of the gold standard for tick-borne illness testing. So that's another thing that we do offer. But again, we're really here to help those chronic patients and also to prevent people from developing Lyme and chronic Lyme in the first place. That's our goal.
Emily May was just sharing something about insurance being able to offset the costs.
So the office visits are cash. However, we do give you a coded receipt that you can turn into your insurance for potential reimbursement, which we do encourage everyone to do. The exceptions are if you're on Medicare or Medicaid, you're not able to do that. All of the blood work that gets run through regular lab is able to be run through your insurance. The prescriptions as well. Obviously, the herbals are not. They're considered alternative therapy, so they are not covered by insurance. But we also have a compassionate care program. So if you do qualify for that, you are able to get some help with funding.
All right, so did anybody else have any questions? You could put them in the chat or unmute yourself. Or if you're in our Hiles audience, ask it. Yeah. Yeah, Jeff was asking, what is the actual utility for testing for the ticks, or like the tick itself, like being able to collect, like I found the tick embedded, I've taken it off, I've put it in a jar. Is it useful to obtain that? Or how?
So if you want to test the tick to see what kind of infections it is carrying, there's a number of different avenues. We use Tick Check here at the Tick Center, so we would mail the tick out. If you just need the tick identified, all of our staff are pretty good at identifying ticks, so you can send us a picture or stop in and we can certainly identify the tick. If you're looking at preventative treatment, by the time you get the Tick Check results back for that tick, you'll be out of the window because it does take about a week to get those results back. So we usually encourage patients to just start the treatment. And also the tick testing is testing for a select few infections. So it's not going to cover for all of those strains that are out there as well.
Hi, this is Janine. I just have a question. I understand when you get tested for Lyme that it actually takes like almost 6 weeks for it to show up. Is that correct? So the first test would always be negative or mostly be negative?
So the testing that is available is an antibody test. So antibodies are what your immune system produces in response to a new infection. Okay, so the testing isn't actually testing for Lyme disease itself or the bacteria itself. It's looking at your immune response. So the reason why we say it takes 4 to 6 weeks to get a positive test is because it takes that amount of time for your immune system to generate enough of a response to get you a positive test. Does that make sense?
Yeah, it does. So it is a conundrum. I mean, we don't have a good test for it.
We don't. Nope. We do not. So we always say, if you have a flu-like illness during spring through, the end of summer, you have to think tick-borne illness because there isn't much else around during those months. Now we have COVID, but you can distinguish COVID sometimes from tick-borne illness because COVID will have those respiratory symptoms where tick-borne illness will not. So, you do have to think about that if you come down with a fever, joint pain, body aches, could I have gotten a tick-borne illness? Because you really can't rely on the test. However, unfortunately, that is the norm for a lot of providers is to run the test and it comes back negative and then no, you don't have tick-borne illness or no, you don't have Lyme and then you don't get treated. So it is a problem for sure. I agree.
Yeah. Wow. And then why would the CDC be so stringent? I mean, I don't know if you can even answer that, but why are they not willing to allow prophylactic treatment much more readily than this ILADS group? Any thoughts on that?
So Lyme disease has been controversial from the start. It's called the Lyme Wars. It's been that way for over 30 years. There is, a lot of theories on that. Obviously, you know, some people think it's corruption. Some people think it's because of money, you know, because the test brings them in money. I don't know the exact reason why, but it has been that way for a very long time. And the testing really has not changed for over 30 years. We don't have a new test.
All right. Well, thank you for all your information. It's been great.
Yeah, you're welcome. If anybody has questions, we do have a email, so it's ticks at aspirus.org. So you can certainly email photos there or questions, and we will get back to you through that email.
Hey Ashley, thanks for the presentation.
Yeah.
I was wondering, do you notice any certain like joints specifically that are more common for people to find their pain? I saw like neck pain, but what have you noticed in your practice?
I mean, we certainly see a lot of knee pain and swelling. So if someone comes in with a swollen knee, that can definitely be Lyme. I've seen shoulders, but most of the time it's like a migrating joint pain. You know, it'll be from like the shoulder to the knee. But the single joints, I would say knees, shoulders, neck, the elbow sometimes. It really varies. But knees are common.
Okay, thanks.
We have a question here also from Jeff. He's asking about if the timing of that deer tick rash, like whether it shows immediately or with more of a delay, if that tells us anything.
Yeah, that's a great question. So the Lyme rash or that target rash will usually come on anywhere from 3 to 30 days after a tick bite. So there's a big span of time that you could develop that rash. If the tick is still embedded and you have redness around that bite site, that is just bite site irritation. So the tick saliva is very irritating to our skin. It has a lot of different enzymes in it to keep our blood from clotting and to keep the blood moving. It has anesthetic in it so that we don't feel the tick bite us. And all of those things can create that initial redness that you see. But the Lyme rash or that target usually comes 3 to 30 days after the tick is removed.
He was just clarifying, you said 3 or more days?
3 to 30. Yep.
That is a range.
And that's not just the rash, it can be any of the symptoms. So the flu-like illness can come 3 to 30 days after that tick is removed.
I guess I just kind of had a environmental question myself about the type of spraying that a person would do to try to prevent it on the property. I guess that's probably just the same pesticides that would impact everything else, like our monarch butterflies. And do you feel like the tick tubes is more targeted, like able to just get at the ticks, or?
I would say yes, because they're bringing it back to the nests of the mice, which is, you know, a huge harbor for ticks. And those you can just place along the edge of your yard. The other interesting thing that I didn't mention in the slideshow is that the white-tailed deer is actually immune to Lyme disease. So a lot of people think that, you know, ticks contract Lyme disease from the white-tailed deer, but they actually don't. They cannot contract Lyme disease. So the ticks use the deer for a mating ground and also for transportation.
Emily May had a question. Were you able to hear that?
No, I wasn't.
Okay, she's saying that there was a recent study about mice, where they're like targeting the mice with the antibiotic. And she,
The biohack to filtrate where the spread is coming from. And so you got mice with this antibiotic. It was just posted too. Is that have
less of a question and more of a like, this is some cool.
I'm just
Okay,
curious,
yeah.
like there might be ecological implications doing that. Like we've done things like this before and they've backfired,
Yeah.
but wondering if you had heard of it and what your philosophy was.
Yeah, I have not heard that yet. I haven't seen that article yet. But sounds interesting. I think they've just tried so many different things. I know there's a vaccine that is supposed to be coming out through Pfizer. But again, there's a lot of questions surrounding that too. It's just a really big problem right now. And we just keep seeing more and more ticks and more illness.
Jamie had a question in the chat. It was, if the rash can come 30 days after the bite, and that's the first you know of it, will doxycycline work still, or is it too late for that?
Yes, so doxycycline will still work. It's just a longer course than what you would get if we were trying to prevent the development of the infection. So once you have the rash, the treatment is anywhere from a month to 6 weeks. Again, it's usually 6 weeks, and that should be a long enough course to get rid of it. You know, and then if you still have symptoms, then we would retreat you.
Jeremy Hooper is asking a question here. Oh, thoughts on DEET versus picaridin spray? We were sort of noticing that you hadn't mentioned picaridin.
Yeah, I think that they both can work. A lot of people have preference not to use DEET. So I think there's definitely ways around it. But I think any protection is better than none. So I guess I don't have a specific preference.
Saying thank you. Any other questions? Oh, one more over there from Jeff.
There side effects or adverse events that are associated with
Are there adverse effects, side effects, possibly, I guess, drug interactions, maybe, or big ones associated with the I'm gonna also mispronounce it, but you know the one I'm talking about, the hydrochlor.
The hydroxychloroquine.
Yeah.
Yeah. So hydroxychloroquine, how we use it is in our chronic population, mainly for patients who have babesia and have a lot of joint pain and inflammation. So hydroxychloroquine is an anti-malarial, but it's also used in the rheumatology world a lot for lupus and arthritis management. So it has great anti-inflammatory properties, and it can help immensely with joint pain. The side effects, you do have to be careful if you're on other drugs that have the same side effect as hydroxychloroquine. And that would be where it can prolong a part of your heart conduction system. It's called the QTC. So normally if you're on another drug that has that same side effect, we usually get a baseline EKG or a heart reading to make sure that it's okay before we add the drug in. And then we check it again in 2 weeks. But it's a very well tolerated drug. Most people don't really have many side effects. There is a rare side effect that I've never seen where it can affect your peripheral vision. Usually in patients who take it in very high doses and for years and years. Again, I've never seen that, but it is a very helpful drug in this population.
Thank you so very much. Are there any other questions from anybody? Let's see. I'm not seeing or hearing any, and I wanted to say thank you so much, Ashley. You've shared so much with us, and very rare to get like that much attention from your doctor. So thank you.
You are welcome. Yeah, if you guys have any questions, you can always just shoot them our way. Happy to answer them.
Thank you so much.
All right, thank you.
All right. Well, we're going to sign off and thank you all for your patience with us with our live from Hiles, Wisconsin technical difficulties. And yeah, we've got a recording of this, and so that hopefully will, with permission or continued permission, go up sometime on the YouTube channel. Thank you so much. Okay. Good night, everyone.